Hello dear students, in this video we will learn Apgar score.
Apgar score. The components are easy to remember by the mnemonic Apgar.
The components of Apgar score are A for appearance, P for pulse or heart rate, G for grimace or reflex irritability, A for activity which indicates muscle tone, R for respiratory efforts. If the newborn is completely pink, the whole body and extremities are pink, heart rate is more than 100, actively moving all the four limbs with good cry, with sometimes coughing or sneezing or cry, then we give a score of 2. If the newborn's body is pink but extremities are blue, which is called acrocyanosis, and heart rate is less than 100 with mild grimace, some flexion of extremities with slow irregular breathing, then we give a score of 1. If the newborn appears bluish, cyanosed, or pale, with absent heart rate, completely limp on stimulation, with no response, and respiratory efforts are absent, then we give a score of 0. The maximum Apgar score is 10. Now we will learn with an example.
First component is appearance. As there is acrocyanosis, which means the body is pink and the extremities are blue, the score for appearance in this baby is 1. Component is pulse, which is 135 beats per minute. As mentioned in the question, the score for pulse is 2. Third component is grimace or reflex irritability. Here the baby is actively crying, so the score for grimace is 2. Fourth component is activity or muscle tone. As the baby is actively moving and has good muscle tone, so the score for activity is 2. Fifth component is respiratory efforts. As the baby has strong cry, so the score for respiratory efforts is 2. So the total Apgar score of the baby is 9.
Hope this was helpful. Thank you for watching.